Many women suffer from very painful menstruation. It can be so bad that a patient may have to be in bed, nauseous or other horrible writhing pain for as much as 2 or 3 days. It's gotten to the point where most people think this is normal menstruation. In truth, this is common menstruation, not normal menstruation. Our bodies are meant to have a smooth, easy menstrual experience and easily go through the cycle and on to the next one. But because of organ dysfunction, nutritional deficiencies, and other toxins, our bodies cannot regulate this process the right way. With nutrition response testing, we're able to identify the precise organ functions that are behind this painful menstrual experience and offer the correct nutritional supplementation to fix it. If you'd like to know more about nutrition response testing and what it might do for you, visit our website at michaelformandom.com.